The Devil You Know, Stories of Human Cruelty and Compassion, recently translated at Trey Publishing House, is a book about evil, crimes, change, and empathy. It describes in a compassionate and insightful way therapeutic cases which take place in secure hospitals because the patients have committed serious offenses such as homicide, stalking, or sexual abuse. And the authors of the book are Dr. Gwen Adshead, a psychiatrist with 30 years of experience in forensic psychotherapy, who worked for most of her time in Broadmoor, England's largest secure psychiatric hospital. Dr. Adshead, thank you for being with us.
Oh, thank you for inviting me to be here.
And the life and therapy stories of this book, The Devil You Know, are so vivid and so human, and the credit belongs to Eileen Horn, an American dramatist with a long career in UK as a TV and radio drama producer and writer, as journalist and as a translator. Eileen Horn, thank you for accepting this dialogue.
It's such a pleasure to be with you.
My first question will be for the writer and dramatist Eileen Horn. How did you imagine the work of a forensic psychiatrist before you began working on the book The Devil You Know? And how did you picture the minds of troubled offenders?
It's a great question. I think I'm much like anyone in your audience or any potential readers in Romania, in that I didn't know very much at all when I embarked on this project. Gwen and I are old friends, and I encouraged her to talk to me about her stories because they're important and fascinating. But I came to this probably with a lot of information in my head taken from television crime programs, which are often not very accurate. So I thought the work she did would be very scary, very grim, very hopeless, and without humanity, that these people would be monsters. So very quickly I learned, as she started to talk to me about her real cases, how similar we all are. Gwen likes to say we are all more alike than we are different. And really that's what came across to me as she started to explain some of the people she had worked with. Really, I think that her job is described as described in this book is much more as a psychotherapist because she's both. In other words, she's giving therapy to violent offenders. And so I learned a lot about how much that can change people. Anyone in your audience who's ever had therapy knows that it can be very effective for them, but it can also really change violent offenders. And for that reason, the biggest surprise in the whole process for me was there's hope.
I see. Dr. Adshead, in the book The Devil You Know, you describe several therapeutic talks with offenders, such as killers or abusers, with severe mental troubles. And there will be two questions here. Do these, I don't know, evil, bad people deserve, morally speaking, to get professional help financed by the public budget? First, and secondly, is there any chance to work effectively with such severely troubled and unstable, even psychotic patients?
Well, they're both excellent questions. And if I start with the second one first, I think it's important for me to emphasize that most of my work, not all, but most of my work has been as a therapist with people who've committed serious acts of violence when they've been mentally unwell. So of course, we're talking about a minority of people who of all the people who suffer with mental illness. Only a tiny minority will ever be violent to anyone else. And in fact, they're more likely to pose a risk to themselves. But that tiny minority who do pose a risk of violence do need treatment for their complex and severe mental disorders. And over the last 25 years, I think we've seen a real development and expansion of the kind of psychological therapies that are available for people with complex disorders, including people who are psychotic. As we understand more about what psychosis means, psychological therapies are more available. So that's the second question, that there are definitely therapies that can make a difference, and we have empirical evidence to support that. But as to the ethical question about whether they should get that therapy, I would argue very strongly that it's in all our interests that they should get it, because if we provide them with therapy, that not only improves their mental health, which is a good thing for citizens to have, but also it helps to reduce their risk. And that's good for all of us. So actually, the more that we can understand about those few people who become violent when they're mentally ill, the better we shall be for thinking about how we could prevent violence in the future and how we can improve treatments. So actually, it's in all our interests that we provide therapy for these men and women, because they're unusual and complex.
Mm-hmm. Eileen Horn, the book includes several references to Shakespeare. And I did like that. What similarities did you find between the characters in this book and those imagined by Shakespeare in his dramas? Could you give us some examples?
Well, Gwen likes to call Shakespeare the first psychiatrist over 300 years before psychiatry was officially invented. He was already doing it. He had the most remarkable insights into the human condition, and I would say particularly into violence. I actually did English literature at university, and of course I've worked in the theatre and in drama my whole life, but all of the references to Shakespeare's characters are Gwen's, because she uses Shakespeare in her work all of the time, because he is so acute and understanding. I suppose for me the best example I could give is probably Macbeth. The idea that sticks with me from all of her stories of her real patients, but also her references to Shakespeare, is this concept that shame leads to violence. I never forget that moment in Macbeth when he's saying, I think I'm not going to kill the king after all. He's been really good to me. And Lady Macbeth says, are you a man, or something, and tries to shame him into doing it. And shame so often precedes violence, that for me, that's just a perfect moment of understanding by Shakespeare.
Mm-hmm. Dr. Atz, please.
I was just going to add two things. I know that there are some very important centers of Shakespeare studies in Romania, and I think that we're all interested in Shakespeare because of these kind of psychological insights. And just to add to what Eileen said, for me, the quote from Macbeth that really speaks to me is, I am afraid to think what I have done. To look on it again, I dare not. And that is really where we start in therapy. Often with offenders, often they are afraid to think about what they've done. And so a lot of the therapy is about helping them feel safe enough to actually man up and woman up to actually turn and look at what they've done and take responsibility for it.
Indeed, you anticipated the following question about the purpose of the forensic psychotherapy that take place in such secure hospitals. What will be? Is it to make the offenders acknowledge, as you said, and become aware of their deeds? Will it be to teach them morality and self-control, or to help them understand what brought them to their crime? How do you work in such special, peculiar settings? Therapeutic settings.
Yeah, well, I think there are a lot of resemblances between the work that we do in our secure hospital and other kinds of hospital that provide complex therapeutic interventions, surgical interventions, complex rehabilitative interventions for people with serious disorders. So in a way, we're much the same. We have a team of people who are highly skilled, highly trained, prepared to invest the time. But one of the first things we do is we do a kind of assessment of the risk factors, the kind of that go to make the violence happen. In the book, we talk about each act of violence being a bit like the result of a bicycle lock opening, and you have to have a number of risk factors in place before that lock opens and the violence explodes.
There are several joining triggers, may I say?
Yeah. So what the first thing we do is to do a really in-depth assessment to try and get a handle on those numbers. And we want the patient to understand those numbers too. So they're coming from the man or woman herself to understand. And then we want to try and help them understand how they came to let themselves do this. what it was that overcame all their inhibitions, all the resistance. I remember one man who said, I was deaf to my own restraints. And what makes a person deaf to their inner restraints? And so we talk with them about that. And that's often substance misuse, alcoholism, intoxication, and painful emotions like rage or shame or hatred. And then what we want to do is to get this person to understand and take responsibility for what they've done, because we think that only by owning that, by saying, yes, I did this and I have to live with the consequences of that, can we really expect them to reach out for help from people to support them, to promote their own mental health, to look after themselves and therefore look after their mental health and reduce their risk. But the ownership and the agency is kind of really important.
Can I just add something to that? On the first page of our book, we chose an epigraph, which is from a letter that Carl Jung wrote to Sigmund Freud, where he says, the reason for evil in the world is that people are unable to tell their stories. And I think what is so important about the work Gwen and her colleagues are doing is they're helping people to piece together their stories, which may be lying on the floor in broken pieces, you know, because they can't remember, because they had trauma, because they did something terrible, and they're helping them to make that mosaic or puzzle come together. And so they know their story. Once you know your story, you can take responsibility for it.
As far as I remember, there is an interview with Carl Jung, and he says that the evil resides in us. We have to find the evil in us, not elsewhere, not, I don't know, not to find any external justifications or things like that. We have to improve our psychological science, this or discipline, in order to acknowledge the, I don't know, the devil in us, to know it better.
And that's very much where the title of the book came from, from a very firm belief in forensic psychotherapy, but perhaps in mental health and well-being generally, which is if we understand our own devils, if we know our own devils better, then we may be in a better position to explore the devils that we don't know. And get ready for those shadow side of ourselves that perhaps is out of our inner sight. But if we take the step to look at our own capacity for evil, then that's going to probably make us stronger and more resilient.
In that order, I would like to finish with a question for both of you. You end your book with an old biblical proverb, and I quote, "It is worth remembering," you say, "that there but the grace of God go any of us." What do you mean by that?
Oh, well, I guess that it's an old idea, really, that we are, all of us, I think, have choices in our lives to make. But we also are affected by the things that happen to us. And often the idea that we are completely in charge of our own destiny, and if we manage to, if we're achieving a good life, maybe that means we're good people. But often we have to accept that chance and luck play a big part in how people turn out. And sometimes bad things happen to people which are not their fault, which have a big impact on what happens next. So I think that what we were trying to communicate here is that actually the people who do terrible things, we might be those people if we had had some of the same experiences as they'd had. And that actually, you know, it is, we know we need a kind of grace to live good lives in the world. But what do you think, Eileen?
Well, I think that's exactly right. But I also think that there's a sort of image that comes to my mind, which is of a volume dial. So we all have a 1 to 10 volume for jealousy. I can't imagine there's a person in your audience, or you, or either of us, that hasn't at some point in our life felt jealousy. But maybe it's on a volume level of 3 or 4. Maybe it goes up to 6 if your partner's ex-girlfriend walks into the room. But it probably rarely goes to 10. If somebody has other risk factors and it goes up to 10, the dial turns quickly, that might tip them into violence. So I think what we have to understand is we all have that dial, and anything, something quite random could tip us over if other risk factors are in place. And I hope that people who read this book will finish and think, I could be one of them. And I guess that's why we wanted to end with that quote. They're not monsters, they're people.
Yes, it's a very compassionate, as you are saying in your subtitles, a very compassionate message, after all. And Dr. Gwen Adshead and Eileen Horn, thank you for explanations, and also for your warm and insightful book, The Devil You Know, Stories of Human Cruelty and Compassion. Thank you.
Thank you. Thank you.